October is Breast Cancer Awareness Month, and one breast cancer survivor, Dee Dee Ricks, is hoping to shed light on a different side of the disease by telling her story in a film airing on HBO.
Certainly when you're poor, you have low access to preventive health care and low access to treatment that others can't afford. So it's not only a medical challenge, it is a moral challenge. And our people are dying because they're poor and because they're uninsured.
What's going through my head is, how can you go to a woman and say, our healthcare system will take care of you, when we've failed her at every other level?
You may not be able to change who is poor, but I believe, and I have shown, I think, that you can change what happens to people who are poor.
And Dee Dee Ricks is here along with Dr. Harold Freeman, CEO and founder of the Harold P. Freeman Patient Navigation Institute. Good morning to both of you. It's great to have you here. Doctor, we'll talk to you in a moment. But Dee Dee, let's first hear your story. You were diagnosed with cancer in 2007. I know that you're cancer-free now. How are you doing?
I'm feeling wonderful. Thank you.
And so you went through 8 different sessions of chemotherapy. You went through this as a single mother. How was it when you found out, just shy of your 39th birthday, that you had breast cancer?
My first thought, my sons were 2 and 5, and I immediately went to the place if something happened to me, they would never remember me. So I started filming moments with the kids, and thus the documentary evolved to this.
And of course, you were quite the high-powered Wall Street type back then. You had the money, you had the resources, and even for you, you discovered that dealing with insurance companies was a full-time job.
I don't know how women today do it. I see, on the documentary, you see my battle with the insurance companies. And, one of the things that I learned through the process is to really get through it, you really need to understand and have someone navigating you through the system. So, research is important, advocacy is important, but holding someone's hand through the entire process and getting them through diagnosis to resolution of the disease is really what I'm doing with Dr. Freeman today.
And I know that is where Dr. Freeman comes in, but you did, as I understand it, have something of a revelation. As you were going through this terrible battle with breast cancer, you looked around that hospital waiting room and you saw there were those who had far fewer resources, and you wondered, how are they managing this? Tell us about that moment for you.
The questions were coming. What do you mean I can't pick up my child for 30 days after having a double mastectomy? How am I going to drive to work? And all the things that, I wasn't facing because I had help and people to take care of me. So it was at that moment that I vowed to help women that didn't have access and to give them the help that they needed.
And I know that's when you got connected with Dr. Freeman. And Dr. Freeman, I know you put it bluntly. Your philosophy is that having cancer and being poor can be a lethal combination.
That is so often the case. For the 40 years I've been in Harlem, I've faced many, many poor women with breast cancer in particular, and there are great barriers in getting into and through the healthcare system in a timely way. Therefore, these women tend to come in very late, and many of them will die because of that.
And in fact, Dee Dee, one of the most powerful aspects of the documentary is that you met a woman named Cynthia Dodson who also was struggling with cancer, and it documents your parallel tracks. Tell us about her and what happened to her.
Cynthia was amazing. She was me. She was me. I mean, the only difference is that I was white and she was African American, but she was full of life and full of energy, and she was really an inspiration to me.
And she passed away.
Yes, we lost Cynthia, which happens way too often when women come in stage 4 and are uninsured.
You have the Patient Navigation Institute,
yes,
and we just heard Dee Dee talk a little bit about it, but in the few seconds we have, why is it important to have a navigator?
Yeah, a navigator can eliminate the barriers that people face when they try to get through the system. Barriers related to fear and distrust, communication barriers, no insurance, complexity of the system. So one-on-one accompanying, guiding people through the system is what navigation is. And it has results that we've improved survival of breast cancer from 39% to 70% by screening and navigating in Harlem. And this program is becoming national now.
Well, Dr. Harold Freeman and Dee Dee Ricks, thank you so much for your time. The documentary is amazing to watch your transformation. So thank you for coming and sharing your story. We appreciate it.
Thank you, Savannah.
Thank you very much.
And The Education of Dee Dee Ricks airs tomorrow night on HBO.